Good evening, listeners, and a warm welcome to Views on Health. Back on the program this week is Dr. Isurujith Liyanage, consultant gastroenterologist and hepatologist of the University of Sri Jagadhanapura. Having discussed reflux last time around, the topic under discussion tonight is cirrhosis of the liver. We have been focusing on cirrhosis over this series of programs, but over and over again, the cases seem increasing, and as a matter of fact, it's so common, and also the fact that from a lay perspective, we wonder how someone can have cirrhosis when they don't drink, because cirrhosis is commonly associated with constant and I would say regular large intake of alcohol. Having said that, there are various aspects of this issue. So let me hand the microphone over to Dr. Liyanage to discuss cirrhosis of the liver.
Good evening, Fatima. It's a pleasure to be on this show again. So we're going to talk about another fairly common condition that is called cirrhosis of the liver. I'll first tell the listeners what cirrhosis of the liver means. So our liver is an organ that has a lot of functions. It's a very complicated organ, and throughout time in some people this liver tends to fail and not be able to do its work properly. And that often is a part of its cells or cells of the liver being damaged for some reason, and these damaged cells cannot be replaced by the body at the rate that it is damaged. I want you to picture a brick wall, and on one side someone's building the wall, on the other side someone's hammering it and breaking the wall down. And when this, usually in a normal person, the rate at which the cells are damaged or the brick wall is damaged is at the same as the person who's building it. But for a lot of reasons, if this damage occurs at a more rapid pace, then the body is unable to replace or repair the organ, and you end up getting we end up losing the reserve that we have. And what happens when the cells are broken down, it's replaced. Now, when it cannot be replaced by the normal cells, it's replaced by what we call scar tissue. So that's what happens. Now, when you have a wound, you end up getting a scar. So similarly, similar kind of cells replace the liver cells. So ultimately, the liver ends up getting or losing its function. Now, the liver is a remarkable organ in the sense that it has almost 3 times the capacity to kind of provide services for a normal person. So you would not feel until almost 2/3 of the liver is destroyed or not working properly. We would not feel, we will not know that there's something going on. And when it comes to that tipping point where the liver is unable to sustain the normal functions of life, we end up getting symptoms. And that's when for the common person's perspective, that's when we say that someone's having cirrhosis or the liver dysfunction. Now, on the other hand, from a medical point of view, there are different ways we assess the scar tissue in the liver. I told that when the liver cells are being broken down, and some other types of cells will replace it. So those cells are called scar tissue. So when that scar tissue are excessive in number, you medically get most probably in an ultrasound scan, someone can be told that they have early cirrhosis or cirrhosis of the liver. Now that, from that point of view to the point where you lose the function and end up getting symptoms, it's a long journey. And it's a spectrum of so there's a spectrum in this disease where in the earlier or the milder forms as I mentioned earlier, and telling again and again, the person who's having this will not feel anything. They'll not know that there's something going on, and they will be absolutely normal, but they will have a liver that is slightly damaged. And usually, I'm not saying always, but usually at that point, the lifespan of the person will not be adversely affected. So it's not going to be drastically affecting your life expectancy. Now, the other end of the spectrum is when you have cirrhosis, when you have symptoms, when 2/3 of the liver is damaged, and people would have swelling of their feet. I'll probably be explaining what they feel in a little bit. So when they start getting symptoms, that is a point of time where their life expectancy is very severely affected.
So unfortunately, one doesn't know till it really sets in pretty deep.
Exactly. So that is the essence of the message that we want to give to the listener. Now, it is important to identify the risk factors for getting this, or rather getting your liver damaged, and keeping in mind that until you come to a point where, well, it's a point of no return, and it is also a very complicated and an adverse point where your life is very badly affected. We often tell the patient that it is akin to having a cancer, because your life when you start getting symptoms, when you start getting swelling and yellow eyes and all those things, we usually lose about 50% of our patients within 1 year. So it's that complicated and that problematic when you start feeling it, and by that time it's quite too late.
Doctor, from our end, a lay perspective, won't there be any kind of sign that one can think, well, this is going to bad, there is a problem, there's something, maybe is it lack of appetite, or it's, I don't know, nausea, whatever? Could there be some sort of symptoms that can still, instead of waiting till one sees, swollen feet and all of that?
Yes. So probably first I would like to kind of mention the common reasons for people to have liver damage. Now, one of them we extensively discussed last time, which is non-alcoholic fatty liver disease. So that is when you have excessive fat, and I briefly mentioned alcohol at that point also. So alcohol would cause a similar kind of a liver injury. Historically, alcohol had been the number one cause for liver injury, especially in Sri Lanka, and across the world we have other infections or viral infections which are called hepatitis, and commonly it's hepatitis B and hepatitis C. So those infections also can cause liver damage that ends up in this condition called cirrhosis. In addition to this, there are a lot of other less common conditions, and one of them is your own immunity attacking the liver. So there are some immune liver diseases, and there are some diseases where there's increased deposition of copper and iron, and some of the conditions run in the families. So irrespective of all the reasons, well, first of all, what you feel might change based on the reason and the disease that leads to liver damage. So it's very difficult for us to kind of give a specific set of things, or rather symptoms or things that you'd feel if you have ongoing liver damage. Most important thing is to understand that the commonest reasons are non-alcoholic fatty liver, which you can estimate that you can get it if your lifestyle is not good, if you're on the rather obese side, and if you're taking a lot of alcohol. So these are the risk factors, and it is, if a risk factor is there, it's good to be careful rather than thinking or waiting for you to feel that there's something going on. And when it comes to those latter stages, it's very often you feel that you have lost your appetite, you lose your appetite, and you can have some swelling in the feet, swelling in the tummy, and what we call jaundice, that is yellowish discoloration of the eyes, and sometimes urine can be darker, and further advanced disease can interfere with the brain, and early features would be reversal of sleep pattern. That is, you don't fall asleep at night and you feel drowsy or sleepy during the daytime. So these are all complications of this condition that can come up quite late in disease.
So end of the day, doctor, one cannot put an age, I would say, for this condition, because if somebody starts taking in alcohol at a young age and continues, I mean, it sometimes it's a done thing for some people. You see that it's so common in society. It's some people can't do without their so-called drink or drinks, and it's a bit sad when you see that there's so much that they have in life to look forward to, but their sort of lifestyle per se impacts on their future. So so age is not, I would say, a factor here. You can't say that an older person will get cirrhosis. Somebody young can get cirrhosis as well of the liver.
Indeed. So it's so another point related to that is that, first of all, it can happen at any age. Even younger children, due to a lot of kind of other very rare causes, can end up getting liver damage. But now, again, an important thing our listeners should understand is that, just like a lot of other diseases, the common understanding is that these are all multifactorial. So the damage is contributed by different pathways, and one of them is a genetic what we call genetic susceptibility. So sometimes people are more susceptible to get liver damage. It's just like you are susceptible to have diabetes, heart disease if your parents or close relatives have the same condition. Now, this is the reason why, again, we have heard people saying, my neighbor drinks a bottle a day and he had lived up to the age of 90 without any problem, and they find that as a reason to consume excessive alcohol. And they would say, I know this person who's 90 or 120 kilograms of weight and he's absolutely fine, so I'm just 70, so why should I bother? Now, they're all taken on an individual basis, and different people can have different risk factor profiles and different susceptibility. So maybe that person who's 120 kilograms will not have fatty liver at all, whereas someone who's 70 can have advanced fatty liver that can end up being in cirrhosis. So it's not, you should not necessarily look at people, but you should identify that we are all at risk. And again, we are playing with numbers here, because now, if you take smoking and cancer, it's not that everyone who smokes will get cancer, but it's just that people who smoke are more likely to get cancer. So, and we are looking at 90-year-old person who smoked a packet a day for 60 years and say that he didn't get the cancer. He's that 1% who didn't get the cancer, and he's the living person to tell us that he didn't get cancer. But there are 90 other people who died. That those dead people do not talk. So that's the message that I want to give to our listeners. When it comes to risk factors, we extensively discussed the risk factors last time. We're probably continuing what we discussed last time. So it's those risk factors you need to identify if you have them, and they're mainly alcohol and lifestyle and sedentary lifestyle, eating a lot of unhealthy food and being very non-active. So those kind of risk factors, if you have, it's good to modify them. And also, if you have been told that there is some sort of liver damage, even if it is minor, at one point either in a scan or some blood test, it's always good to be very cautious about it, careful about it, because you will not feel or you will not know that there's something going on inside your body until it's quite too late.
Any possibility of a test showing some sort of damage to the liver?
Yes, so it's again a series of things. We look at the whole person in kind of in a more overall way. So we do the clinical assessment, and then we look at blood tests, and then they have scans that we can do. And then we look for complications of this disease. So if they have liver damage, then we see if their scarring or that liver damage is excessive, and if it is excessive, then they can have a lot of complications arising on that. So that is again something that I want to direct our conversation to. What are the problems that they can have, even if they have early or cirrhosis where they don't feel anything. So this kind of, when the liver is affected like that, that can, one of the commonest things that can happen is that it can increase the blood pressure in the blood vessels that feed the liver. So they arise from the gut and they come to the liver. That is how all the food that we eat is taken up by the liver, and the liver is the processing plant of these food and the distributing center. So these blood vessels get kind of strangulated because the liver shrinks, and that those strangulated blood vessels kind of can rather enlarge and swell up, especially within the gut, especially in the stomach and the upper food pipe. And that can give rise to bleeding. That's why we have heard of people who have had cirrhosis and then they vomited blood. So that is the reason why they can have that. So that's one of the complications. So they can have tendency to bleed from the gut. And liver, when it's damaged, can kind of can harbor cancer. So liver cancer again is a very good cancer to have if it is diagnosed early, because there are a lot of ways that it can be permanently cured. I'm saying cured in inverted commas, but it can be quite well controlled. So people with cirrhosis need regular screening to see if they have cancer, and if it is detected at an early stage, it can be sorted out. And also they can have, as I mentioned earlier, they can have swelling, they can have imbalances in water and salts in the body. So it can kind of, because liver is a very pivotal organ and it has a complicated functionality, when cirrhosis advances, it can affect almost every system of the body. So they can have a lot of complications. Now, when we look after a person with this kind of a disease, now for our listener, what I want to emphasize is that during the early phase where you don't feel that you have something going on, it's very important still to follow medical advice, follow the tests, and give according to the protocol or the schedule given by the doctor, because it's a must that we routinely monitor them to make sure that they don't get any of those complications. And once they get the complications, then it's a matter of managing them, and then it's a bit of a delicate balance where they have ups and downs, and then we need to look after them more closely.
What are the discomforts that a patient goes through?
Well, cirrhosis is not really a very fantastic condition to have, because it interferes with your appetite, it makes you lose your appetite, it interferes with your sleep, it makes your sleep very unsatisfactory, and you feel sleepy during the daytime also. It interferes with your mobility because you have swelling, so it's very difficult for you to move around, and it makes you feel weak. And it also and then finally, once your brain is very badly affected, we become, rather our senses become a lot more impaired, and then finally you lose consciousness. So it's not really a very good disease to have. So they can have a lot of discomfort. As I mentioned, it's a spectrum, it's a whole array of problems that they can have, but earlier in the spectrum they will not feel anything. It's important to look after the liver and make sure that they don't progress in that pathway to this picture that I just mentioned. Having said that, the ultimate way out of this would be, when you have that advanced disease, is a liver transplant. Now, liver transplant is again one of the most complicated transplant surgeries, and it has a very it's a difficult process during that time. But it again, on the longer run, it's one of the very good organs to be transplanted, because liver can tolerate being in another person's body a lot more than the other organs that we transplant. So and we have an excellent set of doctors in Sri Lanka, and the transplant program is being evolved very rapidly, and very soon we will have a very good liver transplant program where that can give hope to a lot of people who have this problem. Having said that, it is something that is considered quite late in disease, so it's not something that you need to look out for, and it is also a very complicated thing, and surgery itself has a very high risk. So again, so it's not something like the other organs that we transplant where you can easily get a transplant. So it's the important thing to remember is to protect your liver and not to go there, but to be kind of at this early stage where you can live a normal life without rather going into that arena.
Doctor, this may not be a very fair question, but I would like to ask you all the same. In Sri Lanka, we have the less economically sort of impacted people who go in for more illicit brews, and we read of them all the time, we hear of them all the time, and so that type of intake of, which sort of it's kind of something that they concoct and they intake. So the intake of that rather can I think, in my opinion, be very damaging to the system as against a refined brew. Not that I'm saying drink alcohol, but that is sort of refined, and it's a different thing compared to the illicit brew that they make with, we don't know exactly what they put into it, but there is something that is very damaging. Just right. Your views on that?
Yes. So it's now it's a bit of a rather a controversial question, I'd say. Well, scientifically proven compound that damages the liver, I'm talking about the liver only, is alcohol. So whether it's refined, whether it's double distilled, single distilled or illicit, it's the content of alcohol that you consume, in addition to the other risk factors that surround you. As I mentioned earlier, if you drink and you're obese, you have a higher risk. If you drink and you have fatty liver already, diabetes, high blood cholesterol, you're at a higher risk. So it is the content of alcohol that we are worried about. Having said that, I understand there can be a lot of other constituents in this illicit brew which can damage other organs, and there could be other substances that can damage the liver. I agree with you, but there's not. We don't know what exactly is there other than we know that there's alcohol in it. We don't know what else is there, so it's difficult for me to comment on that from that context. But it is the content of alcohol, and I don't want our listeners to go with the reassurance that the legitimate and high quality alcohol does not damage the liver. That is not correct concept at all.
Thank you for clearing that. And just one final question. So ultimately, if the condition is that bad, a transplant can help to give, extend life.
Yes.
Would you say that?
Yes. So if it is indicated, now I'll probably talk about the Western perspective, because we don't have it's not properly it's not a national program yet in Sri Lanka, but in other countries there is a program. There are programs in a lot of developed countries. So in those countries, people do get a liver, and they most of them go back to a normal lifestyle. So that can kind of reset all the issues. But having said that, alcohol and recent take of alcohol is something that in the West, especially in the Great Britain, alcohol consumption within the last 6 months is an absolute contraindication for liver transplant. So it is again looked at in that aspect even in the West. So it's something that we need to think of. But again, the take-home message is to look after what you have, and protect the liver by looking at all the risk factors and trying to live a healthy lifestyle.
So you would say that alcohol should be a no-no.
You're putting me in trouble, Fatima. Alcohol, now, based on the latest guidelines and the World Health Organization guidelines, no doctor can recommend even a small amount of alcohol. I'll put it that way. But there is still what we call a safe consumption of alcohol within the public. But as for anything, excessive in excess of anything is not good. So I'll put it that way. But we cannot recommend. So there's the concept of safe drinking or safe amount of alcohol in medical community is no more.
Thank you. That's a solid message, Doctor. And on that note, we end this interesting discussion on cirrhosis of the liver. And thank you so much to you, Dr. Isurujith Liyanage, consultant gastroenterologist and hepatologist of the University of Sri Jayawardenepura, for once again being with us on the program. Thank you so much, Doctor.
Thank you for
It's been a pleasure.
It's been a pleasure.
Hopefully catch you in the near future. My thanks also go to Nishanta Manik-Divella for technical assistance. I'm Fatima Razikada saying good night. And hoping to be with you next Monday, same time on Views on Health.